Hello, hi everyone. It's me again. My name is Faith and I'm on Howie Live. I'm here to talk about the physician assistant profession. So join me, let's talk. And if you have any questions, I'm here to answer any questions you have about the profession, what we do, the kind of things we see, and even how to become a physician assistant. So go ahead and join me, let's talk. My first video, I had to end it because I was holding my phone and it was kind of hard to do that and talk at the same time. Okay, join me. Let's talk about the physician assistant profession. If you're there, yeah, now I see two people. Okay, guys, thanks for joining me. Invite your friends and let's talk about the physician assistant profession. Okay, my name is Faith. I'm a physician assistant by profession. I have a Master of Science in Health Sciences and a certificate in Physician Assistant Studies. I also am currently doing a doctorate in medical science, which is specifically designed for physician assistants. So today I'm going to talk about the profession. It's PA Week. Happy PA Week to all the PAs in the group. Happy PA Week to all the PAs on Howie. Happy PA Week to all the physician assistants in the United States, physician assistants all over the world. Okay, so let's get started, guys. I'm gonna wait a few seconds to see if more people join us. Hopefully we can get talking and answer a few questions and misconceptions. I give you some ideas and just a little bit more about my profession. Okay, all right. I see Lydia Mbugua. Hi guys, say hi if you're watching, and let's talk about the PA profession. So now my phone is steady. It was a little shaky earlier. Okay, all right. So I did print out some information from the American Academy of Physician Assistants. This is the national organization that is responsible for advocating and standing up for the physician assistant profession. So there's some literature I printed out here. First of all, we will talk about what is physician assistant. So a physician assistant is a medical professional who can diagnose and treat illnesses. They can also prescribe medications. They work in surgery, they work in different health settings. So we are not limited and we are not restricted. We work in every healthcare setting there is in the United States. Now, physician assistants, there are other organizations, other names all around the world that use the word physician assistant. Sometimes they use physician associate. Sometimes they use the name clinical officers. In some parts of Africa, like Kenya, they will use the word physician clinical officers. There's some places that use the name doctor's assistants. All those are physician assistants in that they are not, they did not go through the regular medical school, but they are still an integral part of the healthcare system and they contribute towards the nation. So for example, in China, they use the word doctor assistant. In Kenya and other parts of Africa, they use clinical officers. In the United States, we use the word physician assistant. I am a physician assistant certified and licensed in the state of Ohio. I am authorized to prescribe medication. I am authorized to treat. I am authorized to give medical advice, so that's what we do. So if you have any questions, feel free to ask. Mase Craig, I see you. Thanks for joining me once again. Julius Wangore, thank you. I see you. I saw Malcolm. Thank you for joining me. I hope I'm loud and clear. And I'm just here to talk about the physician assistant profession. It is PA Week. Happy PA Week to all the physician assistants in the United States and even people who are not in the United States who are affiliated with the profession. I wish you all well. Thank you for your contribution to this profession. Thank you for your contributions to the health and wellness of the population and humankind. Okay, Julius, good to see you. So what is physician assistants? Again, a physician assistant, like I said, in the United States, it was started in 1967. It was started by a physician who thought that they needed someone in between who can still see patients and diagnose patients and treat patients. A shorter program. We all know how medical school takes about 4 years, and then you might take another 3 years for you may take 3 years for, let's say, residency, and if you're doing a fellowship, you might take another 2 years or 3 years. So this doctor decided that it was important if we can have someone that goes through a shorter period, a shorter length of training that can provide medical services. So that's how the physician assistant profession started. It was started by a doctor who thought that we needed a profession that can go through the training quickly and then be able to provide medical services without having to go through that long, extensive period of becoming a doctor. Okay, guys? All right, so that's how the physician assistant profession was started, and it was started here in the United States. It was started in 1967, and currently we have about 123,000 physician assistants in the United States, and physician assistants work in all healthcare settings. We are not limited. We assist in surgery, we work in every hospital, and we are also we can also be found in clinics and healthcare facilities. There is a physician assistant in the White House, so we are not limited in what we can do and the things that we can do. So yeah, so Malcolm, I see your question. Hi, Carol, good to see you. So like I said, I am here to talk about the physician assistant profession. It is PA week, so that's what I'm here to talk about. I am a physician assistant myself, so that's what I'm going to talk about, the PA profession, the misconceptions. We work collaborative. We work in a collaborative environment with physicians and even other healthcare providers. So we can work independently, although we have to have a documentation on file that you have a collaborative physician. That does not mean that every area of your work you will be working with a physician one-on-one. It does not mean that they will be watching your work or they will be supervising your work, everything you do one-on-one. It just means you work collaborative, and if you have a question, if you have someone you want to ask information from, then you have that person on file as the person to go back to and ask questions from. So that's what the collaboration is about. I work in an urgent care setting. I'm going to talk about myself for this example. I work in an urgent care setting. I work in different urgent cares. I do not just go to one site. I go to different sites, and some sites I'm the only provider there, which means I'm the only one that will treat patients, will see patients, will prescribe, and will diagnose and treat. So all that is on me. So when I say physician assistant, it does not mean that the profession is not. Some misconceptions is that you are working side by side, you cannot work independently. That is not true. I work independently in many health settings. I work in many urgent cares, and I'm usually the solo provider. Sometimes I work in an urgent care that is busy, and I will work with another physician who is an MD or a DO, but I'm never in a situation where I cannot work independently. I work independently, but I do have a collaborative physician with the Ohio Medical Board that is collaborating with me when I'm providing services. Someone I can look up to, someone I can ask questions, someone with more knowledge, someone with more experience, and that's what the physician assistant is. It gives us that we are able to provide services, but we also can work with others to make patient care collaborative. We can make patient care all around great because it's, first of all, let me tell you something. Healthcare is never solo. You get to a point, regardless of what profession you are on, if you are in healthcare, you will need to consult with other providers. You will need to consult with other teams. Let's say you're working in primary care, maybe you need to consult with urology. So even with independence, you are never fully independent. Healthcare is a team-based approach because everyone has to work together so that the patient gets the best care. Hi, Albert. Good to see you. So physician assistants, that's what the medical board and the organization and even the profession gives us our leeway that we can work with our collaborative physician. It does not mean you do not work independently. I work very independently and I work at different sites and I'm usually the only provider there. So in my case, for example, I work in the urgent care setting. In the urgent care, I see anyone with acute health conditions. I do laceration repair. That means if you had a cut somewhere, I'll be the one doing the suturing, and I love that. If you come, you have a big abscess. A big abscess is, let's say you have a swelling that is painful, big, and it needs to be drained. I will be the one draining that, and I also love to do that. I like draining abscesses. Let's say you have something stuck in your ear. I will be the one removing whatever is stuck in your ear. Let's say you have bronchitis, sinusitis, any health condition. I will be the one doing that. Another thing I do is, let's say, for example, you come, you are injured, your child is injured, and by the way, because I work in the urgent care, I see anyone from birth to adulthood. I do not have restrictions. I see all the way. I see kids, I see adults, I see geriatrics, I see all kinds of patients. So let's say, for example, you come, you break your leg, your child was playing outside, they broke something. I'll be the one ordering x-rays. I'll be reading the x-rays and determining what to do after that, providing the next level of care, what you need to do, whether we need to put you on a cast or something like that. That is something that I am qualified and able to do. And all this I do independently in the different urgent care settings I do. So my urgent care, because it's affiliated with a clinic, I do a lot more than just other urgent cares. There are some urgent cares where you don't do much, but my urgent care is so extensive. I do a lot more. I do a lot more procedures. I do a lot of suturing. I do a lot of abscess drainage. I do any foreign body, whether it's in the eye, it's in the ear, I remove that. All that is something that I do. And I prescribe medication, treat patients, just like any other healthcare provider. Rushka, good to see you. So one thing I want to tell you, medicine is medicine. It doesn't matter whether it's a doctor practicing it. It doesn't matter if it's a nurse practitioner practicing it. It doesn't matter if it's a physician assistant practicing it. By the way, those three people are called providers. So a doctor, which is an MD or a DO, and then also a nurse practitioner, which could be an NP, DNP, they're nurse practitioners, and then and even a physician assistant. We all practice medicine. Medicine is the same. It's all about how you apply it. It's all about your skills. It's all about your level of comfort. It's all about your experience. So medicine is medicine. Medicine you receive from a physician assistant is the same medicine that you receive from a nurse practitioner or a doctor. The medicine is the same, and that's why when you see, for example, here in Howie, people ask medical questions, the answers are pretty much always the same from different healthcare providers. Now, that does not mean that we take away from experience or someone who has more experience. Obviously, someone with more experience will know a lot more. Someone who spent a lot of time in residency will obviously know more. But that does not mean that medicine is the same. Medicine is medicine, regardless of who is doing it, whether it's a PA, whether it's an MD, whether it's a DO, whether it's a NP. Medicine is still medicine. So that's what I'm here to talk about, the physician assistant profession. In school, for example, physician assistant profession right now starts at the master's level, which means you have to get your bachelor's degree first. Then you'll be able to get a master's in physician assistant. You take about 27 months, which is almost 2.5, almost 3 years of school after you have your bachelor's degree to become a physician assistant. You have to spend about 2,000 hours clinical training to become a physician assistant. You also have to be licensed. A license can take you have to study for the medical board, for the physician assistant board, and then you'll get your license from the medical board. Now, when you study for the physician assistant license, usually the license, the exam takes about 6 hours. That's how long it takes. So it's not a joke. You have to study long and hard to be able to become a physician assistant. You spend 6 hours of answering about 300 questions to complete the medical board exam and become a licensed physician assistant, licensed and certified. I am licensed and certified. Physician assistants that are licensed and certified, they are called PAC. You have dash C under your name to mean that you have been certified, you passed the boards, and you met the requirements to become a physician assistant. Now, like I say, for me personally, I chose to become a physician assistant. I graduated top in my class. I was the first, #1 student in my graduating class in 2006 from Rust College. You can check. But I chose to become a physician assistant. For me, I wanted something shorter duration. I wanted something flexible. I like flexibility. Last year, I was working in family medicine. This year, I'm working in urgent care. That's the flexibility that the physician assistant profession offers me. If I want to work in neurology next year, I can work in neurology. If I want to work in surgery next year, I can work in surgery. I can work in different areas of medicine that I wish without having to go through additional schooling. All I need to do is someone willing to train me, and I'm good to go. So that's, for me, was the biggest thing why I wanted to become a physician assistant, and why I'm a physician assistant today is the flexibility. We can work in different medical specialty. I could be working in pediatrics. I could be working in anywhere I want. I'm not restricted. It's not like once you choose one part, that's it. Now that for me will be very hard and very boring. I really like flexibility. I like diversity too. So, and that's why for me it was important to become a physician assistant, and that's why I'm a physician assistant. I did not become a physician assistant because I cannot go to medical school. No, because like I said, I was the top student in my class. And I did not become a physician assistant for any other reason other than because I liked the flexibility. I liked shorter duration. I did not want to spend 7 years in one field and then realize I'm not enjoying that field, and then I want to change and I cannot change. So that's why I became a physician assistant. And there are many physician assistants, smart people contributing greatly to the profession, contributing to healthcare, and we are all saluting you for the good job you're doing. So if you have any questions, feel free to ask me. We have to maintain continuing medical education hours every 2 years. We have to have 100 hours of continuing medical education. So education is never over, but I like this kind of education because it's something that I'm doing on my own terms, my own, whatever you like to do, that's what you do. Continuing medical education, maybe reading literature, attending conferences, those are some of the things you can do to maintain your physician assistant certification. There are about 255 PA programs in the United States. The physician assistant programs are competitive, and they usually choose some of the best, as you can tell. Another thing is the physician assistant by itself, the selection process. Some of the people that join the profession as people that maybe they were practicing as doctors in other countries, then they come and they become physician assistants in the United States because, again, it's shorter, quicker, flexibility, and these are some of the things we enjoy as PAs. So if you have any questions, feel free to ask me. Like I said, the profession is still growing. It was established in 1967. We are a small group of people, but our contributions are not small. We are contributing greatly to the healthcare system. Yeah, thank you, Albert. Thank you. So anyone have questions? If you have any questions, feel free to ask. And by the way, if you are considering the physician assistant profession, you need a mentor, please reach out to me. I'll be happy to offer to guide you through the process. It was not easy for me when I became a physician assistant. First of all, I have 2 children. So when I was in physician assistant school, I had a 1-year-old, and I also had, I became pregnant. So I had 2 kids in the PA program. It was not an easy thing. The thing about PA school, you cannot do it part-time. It's full-time. There's never like, oh, doing a few hours here and there when you wish. You have to do it full-time. Most people are not able to work when they are doing the PA program because, again, it's full-time and you have to spend all your time either studying or doing clinicals or doing your exams. So we don't have flexibility of just going when you want to. You have to be there from the beginning to the end. So that's, and we do a lot of clinical rotations before you become a PA. When I was a student, for example, I did a clinical rotation in internal medicine. I did another one in family medicine, pediatrics. I also did emergency medicine. I was among the few chosen to do dermatology rotation with the Cleveland Clinic. So I did dermatology. I also did, what other one did I do? So I did about 10, and in these 10, it's diverse. Surgery was also one of the things I did, and surgery was also another rotation I did with the Cleveland Clinic. So again, it's diverse, and you get to do a lot of things. You get to experience a lot in the clinical setting, and then you determine where you want to work. And then even when you work in an area and you feel like you want to change, you can change. People have worked in one area. Let's say they worked in emergency medicine for 20 plus years. They feel like they want to change. They no longer want to work the hours in emergency medicine, the long, crazy hours. They want to work in urgent care. They are able to change. And that's the flexibility that the physician assistant profession offers. That, to me, was the biggest thing. Because at the end of the day, it's not just about how much you make. It's about, are you happy? Are you flexible? Are you enjoying what you're doing? Burnout is very easy. And the fact that we can change, it kind of helps you avoid burnout. I changed from family medicine to the urgent care. And I like the urgent care setting. I like dealing with stuff as they happen, acute medical conditions. And when I worked in family medicine, I also liked it. Oh, and another thing I also do in the urgent care is if you come with an STDs, I can do swabs and check for that. And also, if there's any STDs there, I treat you for it. So we do everything, just like physicians and any other healthcare professional. We work side by side. Sometimes I have the good, when I work with some of my colleagues who are physicians, the good thing is that I ask them some things. I feel like I'm so blessed in this profession because I don't have to go through those many years, but I'm still benefiting from that collaboration. I'm able to ask my colleagues, what do you do about this? How do you usually handle this? And I'm able to tap into their knowledge because I'm working collaboratively with them. And so this is helping the patient. It's certainly helping the patient. It's not about me, it's benefiting the patient. To learn from someone who has been in the field for years and to gain from that knowledge without having to spend extra time in the clinical setting trying to get residency, that's a huge benefit. Now I will tell you, there are some physician assistant programs that have residency programs. So if you are interested in residency, there are some residency programs for physician assistants. You are welcome to do them. I am a physician assistant. I have a master's in Master of Science in Health Sciences, but currently I'm pursuing doctorate in medical science. So again, that is a PA-specific doctorate, and what I'm doing there is global health, learning about global health, learning about healthcare law and everything else, possibly learning how to write a research paper. So that's also another thing I'm learning in my current program, and it's beneficial to me because of just the fact that I'm in Hawaii. Global health is just something that I'm passionate about. Also, another thing about becoming a PA is, again, you are flexible. You can work anywhere. So you don't ever feel restricted. If you are tired of one area, you can move to another area. It's very much allowed. And that's the exact reason why we collaborate with physicians, because can you imagine me coming from urgent care and then going to work with neurologists straight away? I will need someone who has been there, who can guide me through that process. So that's how we work with physicians, and we collaborate with them. It's not a bad thing. It's because you're new, you need that experience, someone to guide you through the process. And once you're knowledgeable, you do everything on your own, just like any other healthcare provider. So we are a profession that basically learns on the job. We learn on the job, and our education never ends. So we just learn on the job. Okay? Guys, do you have any questions? Otherwise, I'll be done. If you don't have any questions, I'll be done with this session. And I will answer any questions if you have them, and feel free to ask. And like I said, if you are considering the PA profession, reach out to me. There's a central application for physician assistant called CASPA that people use to apply for the different PA programs. You get to choose which programs you want to apply to. There are about 255 plus PA programs in the United States. So if you are in Kenya, let's say you are considering coming to the United States, or you are in any other part of Africa, and you have worked as a clinical officer or a medical professional, and you want something to do when you come here, you want to transition to another healthcare profession, physician assistant will be the good profession to transition to, okay? And if you need guidance, explanation, or if you need just someone to direct you on what to do, feel free to reach out to me. Okay, guys? All right, I felt like I was talking to myself. No one was asking any questions. What bachelor degree do you need to enroll to be a PA? So actually, do you know you can have any bachelor degree to be a PA? One of my classmates, who is a physician assistant right now working in orthopedics, I think, or neurosurgery, I'm not sure which one. He had a bachelor's degree in music. Yes, you can become a physician assistant with any bachelor's degree. So, but the thing is, though, you have to do the prerequisites. There are some science courses you have to do and take before you are accepted into the PA program. But you can have any degree. So some of my classmates were nurses. They were nurses. They became physician assistants. They wanted to be physician assistants. Their path was nursing, although they could have been nurse practitioners. They decided she wanted to be a physician assistant. I know one of my classmates like that. And then there is also, I gave you the class president in my class when I was a student, had a degree in music. He became a physician assistant by simply taking the prerequisites that are required. There's a list, and you can always find based on which program you want to attend. You can look down and find which prerequisites, which courses they require you to take, and you take those courses, and regardless of what degree you have, you can become a PA as long as you pass those prerequisites. Okay? Sometimes they want clinical patient encounter hours or patient experience or something like that. That is something you can definitely maybe shadow a physician assistant or shadow an MDDO, and then you get that shadow experience, and that will be helpful for you in your application. Another thing is even if you work as a CNA or any anywhere in healthcare setting, if you have that patient experience, patient encounter, you can use that in your physician assistant application, and that will be helpful to you. Okay? Yeah, so let me see. Any questions? Hi, Fanny. Good to see you. Did I miss any question? All right. Yeah. So if you have any questions, feel free to ask. I'll definitely go back and answer. Like I said, any profession can become a PA. You just need to do the prerequisites and you'll be accepted. But you need a bachelor's degree to get into the PA profession. And then after the bachelor's degree, the PA profession, you'll get your master's degree, and then you can further that. There are some PAs who have gone on to become DOs, and there are some PAs who have gone on to do MDs. And for me, I decided, what do I want to do? Do I want to do PhD? Do I want to do MD? Do I want to do DO? Because, you know, there's so many things you can do. And I decided I'm going to do the DMSc, which is Doctorate in Medical Science, which is something that is already within the profession. And I knew I'm not going to get any new information in medicine when I become a DO or MD, because medicine is medicine. So there's no new information that I was going to get by becoming that. But I appreciate the new information that I'm getting with the Doctorate in Medical Science. I'm getting information in global health, and I'm getting information in healthcare law. So those are why I'm doing what I'm doing, which is the Doctorate in Medical Science. Okay? Thank you, Fanny. Thank you guys for joining me. If you have any other questions about the PA profession, please feel free to ask me. Let me see if I left anything out. Yeah. Okay. Yeah, so I don't think I've left anything out. And like I said, medicine is medicine regardless of who is giving it to you. Just make sure the person who is giving to you is competent, compassionate, and caring. So that's all you can hope for. Is giving to you is a competent, compassionate, and caring. If it's a DO, MD, PA, NP, the title usually doesn't matter. What matters is the person, are they competent, are they compassionate, are they caring? And I can tell you, so many of my colleagues and even myself, we are competent, we are caring, and we are definitely also compassionate. Okay? Thanks, Julius. If you have any more questions, I'll answer them later. Otherwise, thanks for joining me. I hope I provided some information about the physician assistant profession, and I will answer any questions that you may have later on. Okay? All right, guys. If you are in Kenya, have a good night. If you are in the United States, have a great evening, and I'll see you guys later. Okay? Next time, I'll talk about heat versus cold. This is a topic I should have talked about last month, but I'm still very busy trying to handle other things, and I will talk about that. Which one do you use? Do you use hot or cold in acute injuries? Which one do you use? Okay? All right, guys. Thank you, and have a great day. Thank you so much, and I'll see you later. Bye-bye.